Labor is defined as the spontaneous onset of regular, painful uterine contractions associated with cervical changes and descent of the presenting part. Labor culminates in the birth of a healthy baby followed by the expulsion of the placenta and membranes. Labor is divided into 3 functional stages for clinical management. Let's explore these stages. The first stage begins with true labor and ends when the cervix is fully dilated, typically at 10 centimeters. It includes the latent phase and established phase. The latent phase is when contractions cause some cervical changes, while the established phase is marked by regular contractions. The second stage of labor begins when the cervix is fully dilated and ends with the delivery of the baby. The third stage begins immediately after the baby's delivery and ends with the expulsion of the placenta and membranes. First stage of labor is the longest stage. It begins with regular, effective uterine contractions and ends when the cervix is fully dilated to 10 centimeters. This stage has 2 main phases, latent and active. Let's dive into the details. Phase 1. The latent phase. The goal is to soften and thin the cervix and dilate it to 3–6 centimeters. The duration is highly variable, lasting many hours or even days, especially in first-time mothers. This is the stay-at-home phase. Phase 2. The active phase. The goal is for the cervix to dilate from 6 centimeters to 10 centimeters, achieving full dilation. Typically, this phase is shorter than the latent phase, usually taking only a few hours. It's time to head to the hospital.
The second stage of labor extends from fully dilated cervix until the birth of the baby. The second stage is typically divided into 2 phases, passive phase and active phase. The passive phase begins when the cervix is fully dilated but the woman has no urge to push. Active phase occurs when the woman feels expulsive contractions and starts to push. The duration of the second stage is influenced by whether it is the woman's first or subsequent baby. During the second stage, the baby's head performs movements called cardinal movements of labor. These include descent, flexion, internal rotation, extension, restitution, and expulsion.
The continuous downward movement of the fetal presenting part through the pelvis is called descent. It is most significant in the second stage. As the head descends and meets resistance from the pelvic floor, the chin is tucked to the chest, presenting the smallest diameter of the head. The fetal head rotates from the transverse or oblique position to an anterior-posterior position, aligning with the pelvic outlet. As the head reaches the vulva, it pivots around the pubic bone and is borne by extending the head, with forehead, face, and chin appearing sequentially. After the head is born, it rotates 45 degrees back to align with the fetal shoulders, entering the pelvic inlet. The anterior shoulder rotates and is borne under the pubic arch, followed quickly by the posterior shoulder and the rest of the body.
Stage of labor starts from the birth of the baby until the delivery of the placenta and membranes. This stage is critical due to the risk of postpartum hemorrhage. Its average duration is typically short, around 5 to 15 minutes, with the majority of placentas delivered within 15 minutes. The physiological processes involve placental separation. After the baby is born, the uterus quickly shrinks, leading to detachment of the placenta. Blood vessels in the placental bed are surrounded by myometrial muscle fibers that compress to prevent excessive bleeding. Signs of placental separation include lengthening of the umbilical cord, change in uterine shape, and a gush of blood. Management can be physiological or active. Active management is preferred due to reduced risk of postpartum hemorrhage. Active management includes prophylactic uterotonic administration, delayed cord clamping, and controlled cord traction.
Active management of third stage of labor, AMTSL, a bundled set of interventions usually includes several key practices. Prophylactic uterotonic administration, giving a drug just after the birth of the baby to stimulate strong uterine contractions. Delayed cord clamping and cutting, clamping the cord after pulsations cease within a specified time, allowing for blood transfer to the baby. Controlled cord traction, CCT, applying gentle, sustained traction to